All right, guys. Let's continue on with the meeting that we have for you guys today. Oh, and by the way, I'm Aderin. I am, again, president, just to reintroduce ourselves.
Hi everyone, my name is Kirsten. I also serve as your co-president.
Hi guys, once again, I'm Shagun and I am the secretary.
My name is Austin Nguyen and I'm one of your co-treasurers.
My name is Catherine and I am one of your co-activity coordinators.
My name is Jolie and I'm the other co-activity coordinator.
All right, and feel free to message any of us on Instagram or Facebook Messenger if you have any questions. All right. So today's meeting is going to be like a general introduction into the medical field, so you guys can get kind of a feel for what it's like. These are just some very basic topics.
So why should you enter the medical field? So first off, a lot of people like going to medicine because of the kind of good feeling you get from helping people. And also just making a difference in someone else's life is so rewarding. And definitely going into the medical field, you're going to be secure wherever you go. A lot of places have like medical, they want people come in, and it's really high demand in like anywhere you go. And just being able to meet new people, socializing, really makes you kind of feel good, especially if you really like to communicate with other people. And definitely you'll get a good pay, stable income, and that just increases as you get more experience, more knowledge into the field.
Okay, so let's talk about which fields are the most popular in terms of medicine. So emergency medicine would be top one, and this is a profession concerned with the care of illnesses or injuries requiring immediate medical attention or treatment. So this would be like for people who get heart attacks, seizures, vehicle-related accidents, basically injuries or accidents that require immediate medical attention because they are life-threatening. And next we have pediatrics, which is focused on treating illnesses present in children. And depending on your pediatrician, they can care for you from the age of a newborn to toddlers to teens. And the age range could be newborn age to 18 years old in some cases. And pediatricians also aid pregnant women and new parents and give advice on how to take care of their child. So the third profession is psychiatry, which is devoted to the diagnosis, prevention, and treatment of mental disorders. And so psychiatrists are the people you would go to for mental and emotional inconveniences. They meet with, listen to, and observe patients, develop treatment plans to help and develop treatment plans to help alleviate clients' mental distress. So the most impacted professions would be dentistry, surgical medicine, and orthodontics. So in dentistry, dentists are the people you would go to on like a Saturday morning with your family for a family cleaning. They treat diseases, infections, and other conditions that concern the health of one's teeth and gums. They also handle tooth and teeth extractions. So surgical medicine is the next one. Surgeons diagnose and prescribe treatments for people suffering from injury or diseases. And basically they correct physical abnormalities such as fractured or broken bones, enlarged lungs, and tumors. And orthodontists are the people who would diagnose and provide treatment plans for misaligned teeth and jaws. So these are the people you'd go to for braces, retainers, and Invisalign consultations.
So which medical schools are the best? So Harvard is definitely the highest ranking medical school, and University of Pennsylvania is also known as UPenn. University of Pennsylvania, also known as UPenn, is also an Ivy League with Harvard, and it's also one of the top medical schools. And we also have USC, University of Southern California, and we have Stanford University. We also have Johns Hopkins University, and they also talk a lot about the coronavirus, and UC Davis. And the admission rates is from 1.8% to 7%, and UC Davis is 1.8%, and Johns Hopkins is 7%.
All right, so what's the general education pathway for someone going into medicine? So you definitely want to get your high school education with all your like GEDs, or if you go through the IGETC program, then definitely get all your credits done. And also a lot of medical doctors, they get like AP chemistry, physics, biology. Those are like the main courses that you'd want to take. And also after high school, you're going to college, you can get your bachelor's degree. And usually that's like a four-year college, and that's when you want to get 100 required credits. Definitely you want to apply for your medical school. So right after that, a lot of people go into medical school, or sometimes they save up money before going there because medical school does cost a lot of money. And medical school is where you take the MCAT and you complete your 4 years of received medical degrees. And this pathway kind of seems a little bit long, but there is kind of a lot of education that goes into the medical field. But you get rewards, so many rewards after that. And then after medical school, you go into residency. Depending on your profession, it could be 3 to 7 years. And this is when like you're communicating with like patients, and you're gonna be able to talk with a lot of people. And also you can get your state license. So after your residency, you practice medicine even more, and you complete the different medical education tests. And finally, you can get your PhD.
So, what kind of people make good medical professions? So, actually, as you can see, I have the top 6 best healthcare jobs, and you can see the median salaries for each. So, the dentist is actually the first in best healthcare jobs, and dentists are basically the people, like Catherine said, you go to them for your mouth, gums, and teeth. They basically do our fitting dentures and cavities. Next, we have the physician assistant. They basically diagnose like illnesses, and they assist in surgeries, perform procedures, and guide patients. Number 3, we have orthodontists, who basically fix our improper bites. You go to them for braces, like Catherine said again. Then we have nurse practitioners. They're registered nurses with additional education. The extra schooling allows them to take patients' histories, perform physical exams, order labs, analyze labs, and a lot of things. So they're basically helping the patients out. Then we have physicians, who are like gynecologists or ER doctors, primary care providers and stuff, and you go to them if you have like fractures or coughs or anything. And lastly, we have speech and language pathologists, who basically help the people who they like evaluate and diagnose like people with speech or swallowing difficulties, and they help you better your speech.
So here's some just super, super cool events that we have for you guys coming up really soon.
Our first one that's coming up this Friday is our first guest speaker. Her name is Shivani Barrett, and she's an aspiring healthcare administrator. So Kirsten in a little bit is going to give you a little bit of background on healthcare administrators, so you guys can think about what questions you guys want to ask her if you are able to come Friday. You can join the guest speaker meeting through this Zoom link, and it'll be on Friday after school between 3 to 4. The deadline to sign up is this Thursday, just so we can, give her a heads up how many people. The officer in charge is Kirsten, so message her for when you sign up. And anyone can come. You can invite your friends. your family members if they want to come and sit in, brother, sister. And if you ask Shivani a question, you'll receive an additional half an act. So it is in total 1 act if you ask her a question.
So someone that messaged into the chat, Himanki, I think you can just message me and you can PM me through a messenger and then I'll sign you up. It's super quick and easy. I just want to give Shivani a head count. So there's nothing you have to fill out or anything. Just text me and then let me know your grade and that's it. So introduction to healthcare administration. So healthcare administrators kind of have a direct overview of the operations of the hospital or healthcare systems. And so they can even work with policy, they can make policy changes, like they can work on a local, state, or federal level. This includes like the FDA or the Food and Drug Administration or health-related national associations like the Red Cross or the American Hospital Association. And so mainly they're responsible for a lot of staffing, budgets, and other management functions. And they don't really deal with patients on a day-to-day basis, like they directly communicate with like patients, but rather they make policy changes and any other needed changes to allow for the like better well-being of the patients as a whole. So they make really big changes to the hospital or the healthcare system. And average salary, it depends. It widely depends because there's so many different levels you can go on. It's between 50K to 170K, but definitely this is just like the average. So it can go way up past 170K. And here's some just helpful skills, definitely professionalism, being able to take charge, interpersonal skills, understanding how to talk with other people through medical language with your bosses and your colleagues, and also healthcare delivery and the financial structure. Knowledge on that is really important because you want to be able to you want to be able to figure out policies for more wealthier people versus low income people.
The next event that we have going on this weekend from Saturday to Sunday is the COVID College application, where you can come and get advice from professionals and mentors on how to fill up your applications. The officer in charge of this will be me, Jolie Tran. So please message me if you are interested, and if you do go, send a screenshot of proof that you were at the event.
So if you guys haven't seen our Facebook post recently already, then here's another act we have for you, which is super easy, and it's called National Suicide Prevention Month, which you can receive half an act for. So all you have to do is publicize the digital flyer on our Facebook and Instagram accounts to spread awareness on this topic, suicide prevention. And it's an ongoing event, so you can participate until September 30th, which is the very end of the month. And I'm the officer in charge for this act, so you can message me via Messenger to confirm your participation. And another act we have, this is a newer one. It's called PopUp Cards for Healthcare Workers, and you can receive 1 act for this. What we're going to do is make pop-up cards for local healthcare workers who are helping us battle COVID-19. And this will be taking place on Zoom on Friday, October 2nd at 5 to 6:30 p.m. So the deadline to sign up is the end of this month, September 30th. And I'm also the officer in charge for this event. And just a little heads up, I will be taking screenshots at the beginning and end of the event just to confirm your attendance.
And Catherine, would you like to tell them where the cards will be going?
Yes, so as I said, local healthcare workers and a very close by hospital is Regional Healthcare Center. So it's really nice to be able to encourage and cheer up people who are working within our community.
Okay, so Med101 is going to have our first fundraiser of the year, and it'll be with Tasty. So if you want, you can support Med101 by buying like snacks or drinks using their app. And it'll be in North Capitol Avenue near McDonald's and like Dollar Tree. And it'll be on October 6th on a Tuesday from 6 to 9 p.m. And to show, for our club to get 50% of the funds, you have to show our flyer to the cashier, and we'll post the flyer soon.
Another event that we still have going on that you can sign up for is a fireside chat with Dr. Annie Fauci. You can listen to an expert talk about the impact of the virus on the country and the American response to it. The event will be on Thursday night, October 8th at 5 p.m. and the deadline to sign up is Wednesday, October 7th. You can message me, and for the event you would have to take 10 notes and send a picture to me with your name and grade on it to receive your ad.
Okay, so I just sent in the link to the form once again because I noticed a lot of new people in our meeting today, and some of us aren't an official member yet. So please make sure that you fill in the form that I just sent, or you can find it on our Facebook page, and fill out the form so I can officially put you in our spreadsheet for and just a reminder again, you only need 2 activities per semester to be active, and if you attend 75% of our meetings, you already get 1 act. So it's really easy. Just please make sure you fill out the form.
So here's more important announcements. So again, our first speaker is this Friday, September 25th from 2 to 4 p.m. We highly encourage everyone to attend because it'd be really great for you to like gain an exposure to healthcare administration, and it's going to be super fun. You just have to ask like questions, like you can ask any questions, Shivani. She's super nice, so it'll be really great on Friday. And you don't need to attend the entire thing. You can just come for like a portion at a time. Let us know that you're there, and then you can just ask her questions, anything like that. And now, from now on, our meetings will move on to every first and third Tuesday at 12:15 p.m., so during lunch. And the reason why we chose this is because we don't want members to kind of like be super busy during lunchtime, like every Tuesday. So we want to like give like a gap during this time. And those fill in like those second and fourth Tuesdays of the month. We'll be posting like our events. So for you guys to sign up on them. And there's gonna be no meeting next week, so have a happy October break. You guys definitely deserve the rest. And stay updated on our Facebook group page. Please follow us on our Facebook page. We're gonna show it in the end of the meeting, but please add us because that's where we communicate the most with our members. And again, if you're interested in in suggesting us any careers or medical topics, you can fill out this form below. We'll post these slides later on, or you can find it also on our Facebook page as a pinned post. And our next meeting is going to be October 6th. So that's the second week of October, kind of after we get back from the October break at 12:15 p.m. And we're going to be learning about neuroscience and what it takes to be a neuroscientist. So look forward to that. And also after that same day is also the TC fundraiser. So after we'll be reminding everyone, and afterwards you can get like a really good dinner.
So please stay afterward if you have any questions, and if you want to sign up for an event, also stay after. If not, thank you guys for coming, and make sure you follow our Facebook and Instagram to stay notified of our events and fundraisers.
And if you guys want to contact any officers, but you have trouble identifying who they are for club events, then you can search the names for the officers in charge. And on our Facebook, we have overlays from our publicist, Kelly, and it says Med101, so that's how you know if we're the proper person to message via Messenger.
Bye, guys.